Social anxiety is a specific form of anxiety. It is an emotion characterized by discomfort or a fear when a person is in a social interaction that involves a concern of being judged or evaluated by others. It is typically characterized by an intense fear of what others are thinking about them, which results in the individual feeling insecure and not good enough for other people, and/or the assumption that peers will automatically reject them. Developmental social anxiety occurs early in childhood as a normal part of the development of social functioning and is a stage that most children grow out of, but it may persist to resurface and grow into chronic social anxiety during the teenage years or possibly in adulthood. People vary in how often they experience social anxiety, and in which kinds of situations they experience it. Chronic social anxiety that causes considerable distress and impaired ability to function in at least some parts of daily life is an anxiety disorder called social anxiety disorder. It is the most common anxiety disorder and one of the most common psychiatric disorders, with 12% of American adults having experienced it. Social anxiety is associated with low social self-efficacy. Stages. Child development. Social anxiety first occurs in infancy and is said to be a normal and necessary emotion for effective social functioning and developmental growth. Cognitive advances and increased pressures in late childhood and early adolescence result in repeated social anxiety. Adolescents have identified the most common anxieties as focused on relationships with peers to whom they are attracted, peer rejection, public speaking, blushing, self-consciousness, freaking out, and past behavior. Most adolescents progress through the fears and meet the developmental demands placed on them. More and more children are being diagnosed with social anxiety, and this can lead to problems with education if not closely monitored. Part of social anxiety is fear of being criticized by others, and in children, social anxiety causes extreme distress over everyday activities such as playing with other kids, reading in class, or speaking to adults. On the other hand, some children with social anxiety will act out because of the fear. The problem with identifying social anxiety disorder in children is that it can be difficult to determine the difference between social anxiety and basic shyness. Adults, it can be easier to identify social anxiety within adults because they tend to shy away from any social situation and keep to themselves. Common adult forms of social anxiety include performance anxiety, public speaking anxiety, stage fright, and timidness. All of these may also assume clinical forms, i.e., become anxiety disorders. Criteria that distinguish between clinical and non-clinical forms of social anxiety include the intensity and level of behavioral and psychosomatic disruption in addition to the anticipatory nature of the fear. Social anxieties may also be classified according to the broadness of triggering social situations. For example, a fear of eating in public has a very narrow situational scope, while shyness may have a wide scope. The clinical forms are also divided into general social phobia and specific social phobia disorder. Social anxiety disorder, also known as social phobia, is an anxiety disorder characterized by an intense fear in one or more social situations causing considerable distress and impaired ability to function in at least some parts of daily life. These fears can be triggered by perceived or actual scrutiny from others. It is the most common anxiety disorder and one of the most common psychiatric disorders, with 12% of American adults having experienced it. Physical symptoms often accompanying social anxiety disorder include excessive blushing, excess sweating, trembling, palpitations, and nausea. Stammering may be present, along with rapid speech. Panic attacks can also occur under intense fear and discomfort. Some sufferers may use alcohol or other drugs to reduce fears and inhibitions at social events. It is common for sufferers of social phobia to self-medicate in this fashion, especially if they are undiagnosed and treated, or both. This can lead to alcoholism, eating disorders, or other kinds of substance abuse. SAD is sometimes referred to as an illness of lost opportunities, where individuals make major life choices to accommodate their illness. Standardized rating scales such as the Social Phobia Inventory, the SPAIB and Liebowitz Social Anxiety Scale can be used to screen for social anxiety disorder and measure the severity of anxiety. The first-line treatment for social anxiety disorder is cognitive behavioral therapy, with medications recommended only in those who are not interested in therapy. Cognitive behavioral therapy is effective in treating social phobia, whether delivered individually or in a group setting. The cognitive and behavioral components seek to change thought patterns and physical reactions to anxiety-inducing situations. The attention given to social anxiety disorder has significantly increased since 1999 with the approval and marketing of drugs for its treatment. Prescribed medications include several classes of antidepressants, selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, and monoamine oxidase inhibitors. Other commonly used medications include beta blockers and benzodiazepines.